see patients of all ages, anywhere from your 60 to 70-year-old recreational runner. We also treat competitive athletes who are cross-country and track runners. And then we will see patients who have never run before in their entire life and they want to start now. Every runner who runs will get an injury at some point. We not only work with the physical aspects of running and dealing with injuries and injury prevention, but we're also going to work on the mental aspects of running. Sometimes they'll have acute injuries caused by running, such as stress fractures, plantar fasciitis, Achilles tendonitis, patellar tendonitis. But we also see chronic issues such as back pain, neck pain, anything that may prevent a runner from progressing their goals or prevent them from even starting. We usually do a 1-hour initial evaluation, and that we can either do the Dorsa-V analysis, we'll do the treadmill running gait analysis, we'll do strength testing, range of motion, mechanics analysis, functional assessment, and at that time we will determine a plan of treatment. Most of it is education, how to progress, what not to do, what to do, and what exercises will get them there.
The Dorsa-V is basically a 3D sensor technology that we use in a variety of ways.
It doesn't change what we already do, but it complements and gives substantial numbers to prove what we're doing is actually being effective.
So one of the ways we use the Dorsa-V technology is with a running analysis. So these 3D sensors are basically the only FDA sensors that are used outside. So we're getting lab quality data, like what they would do when they're running research, but we get to do it in the clinic. So for the running analysis, we put the sensors on. Generally they're running on the treadmill, they can go for a run outside, and the sensors are basically collecting data for every step they take. So for the running analysis, we can do it at different speeds based on the needs of the patient. And the data is basically telling us how well they're moving. So when we're running, it's really a series of single leg hops. So we want a symmetrical pattern, and those numbers come back and tell us, do they load appropriately? Are they striking too hard? Are they spending equal time on both sides? And so the Dorsa-V really gives us data to then complement the iPad analysis that we get to do that looks more at the quality of their movement.
With the iPad video analysis, we slow it down frame by frame, but I'm able to sit down with the patient, blow up the screen, and really teach them on what we're looking for with the running form and everything. So it makes it a lot more interactive because I can sit there and draw angles and accentuate what are we trying to change.
So if we retest them, 3 or 4 weeks later, we can see were the treatments that we were adding and kind of was our plan and therapy appropriate because we're seeing changes in the data. There's a number of ways that you can contact us. On the website, you can get a hold of our schedulers there. We also have a sports injury hotline that you can contact.